Hello everybody, Dr. Goforth here again at Cornerstone Physical Therapy. So if you watched the video before this, I talked about exercises to avoid in the fourth trimester, or basically postpartum after having baby. So now I'm also going to just mention some things to expect that may make you a little wary or concerned, like, is this normal? I didn't have this problem before. But just to kind of know what to look out for during the fourth trimester, and also knowing how things should hopefully go back to normal, and if they're not, knowing when to seek help. So let's just talk about the pelvic organs from front to back to make it as straightforward as possible. So the bladder. So let me grab my pelvic model for a second. So here's our pelvis. It's shaped like a bowl, like the rim of a bowl here. What's not shown, you've got the bladder in front. In the middle is the uterus and the vaginal canal, and in the back is the rectum. So in thinking about that, bladder first. So you might have even noticed during pregnancy, or if not, after you're having some urinary leakage issues. A lot of times this will go away on its own. My recommendation would be, even if it does, whenever your doctor clears you that you fully healed after your delivery, go see a pelvic health specialist like myself or someone else, because it's good to know what is the status with my pelvic floor. You know, if you had a vaginal delivery and you tore, those muscles were injured where they had to stitch you back up, and so they need to be retrained how to function optimally. So urinary leakage, it might be present. Sometimes it goes away on its own, sometimes it doesn't, and you need some extra support and guidance. You might also notice that when you sit down to urinate, not to be crude, but that the spray of how your urine comes out is different. It might not be so streamlined, no pun intended, but it might kind of like come out a little bit differently, and that might seem a little scary, but that's just kind of what happens as the anatomy gets pushed on and stretched a little bit. Now, if it's a lot and you feel like it's really abnormal, again, go see a pelvic health specialist and have it checked out. So we hit bladder first, right behind uterus and vaginal canal. You might notice that sex is painful after having a baby, and maybe it wasn't before, or it was, but now it's worse. So your muscles that we just looked at on the model, they go around the vaginal canal, which is collapsed at the moment, that middle one. They've just been through a trauma from having a baby. So muscles, our muscles' response to trauma is usually hold, tighten. So now they're tighter than they used to be. So when there's a stretch applied to them, which happens during sex, it's like an uncomfortable stretch. Sometimes it feels burny at the entrance. Sometimes it feels sharp or achy during intercourse. And you might not be so interested in sex anymore because it hurts. And that's not normal, but it is something to expect, and something that, if it doesn't go away on its own, again, see a pelvic health specialist to work on them and teach you things that you can also do on your own to help with that. All right, so we got bladder, vaginal canal, and the rectum. So you might have noticed during pregnancy issues with hemorrhoids or some constipation because baby was taking up space in there and pushing back, and it was just a lot of pressure. So if you've developed hemorrhoids, you're going to notice that, you know, they might be something you kind of have to manage off and on. So it's really important to try not to get constipated. A lot of my patients will tell me their doctors have them taking Miralax for the foreseeable future, at least until things have fully healed, and make sure that their stools are soft, they're not having to strain, help the hemorrhoids to calm down. So consult with your doctor on that, but that is what I hear a lot of times. Make sure you're drinking enough water to also help with that. And then the other thing is, if your pelvic floor muscles, again, are too tight, because they go around the rectum, they can literally cause pressure, and it just, that exit way is not as open as it used to be. And again, good to always see a pelvic health PT after you've healed from your birth, just to check out what's going on and what a good game plan would be to get you started on working on things at home. Something else just to mention briefly, depending on how fast your baby comes out, if it's a vaginal delivery, or if they had to use forceps because you were having a really hard time getting baby out, even if you had to have a C-section but you labored actively for a while, really bearing down, sometimes what can happen is something called prolapse, and that just means that one or more of the organs inside the pelvis that we talked about has shifted forwards, down, back, basically where it's not supposed to be. And a way to help with that is strengthening your pelvic floor. So again, need to seek out a pelvic floor therapist. What you might feel if you have prolapse, oftentimes your doctor will tell you that on a follow-up visit, but what you might experience is a heaviness or achiness in your lower abdomen. You might literally feel like something is falling out of your vagina, which might seem really scary, but you might feel that if it's bad enough. And not something to have a panic attack about, but it's important. You want to try to correct that to a certain degree. So strengthening those muscles, seeing a pelvic PT can help get you to the point where at least you're hopefully not symptomatic. So those are things that you can expect in your 4th trimester, and hopefully that gave you some insight of when to seek help. Again, my personal bias is once you get cleared from healing having a baby, go get checked out by a pelvic PT just to know what your status is objectively and talk about good things to work on to heal the best possible and so on. So have a great day.